Welcome everyone to the Extraordinarily Ordinary. Our guest today is Harry. Harry is a psychiatric nurse, life coach, and author of the self-help book, You Can Be Your Best. With over 20 years of experience in the mental health field, working mainly in England, in both the public and private sectors, she came out of early retirement to contribute her skills and knowledge on mental health in this region. She is here tonight to share with us her experience. Welcome, Harry, to my show.
Thank you for having me, Afzan.
Yeah.
Thank you.
How are you today?
I'm good, thanks. I'm good, yes.
All right, let's start. Psychiatric nursing is a relatively unknown profession here in Malaysia. Would you mind elaborating on the responsibilities of a psychiatric nurse based on your own experience?
Sure. Mental health nurse, or aka psychiatric nurse, Afzan, is basically a nurse with extensive training in mental health. So in a ward environment in a hospital, the psychiatric nurse would be part of the therapeutic milieu, whereby she will keep the patient safe, administer medication, report on the patient's progress, liaise with the medics and the patient's relatives, and basically planning for the patient's discharge. In the community psychiatric nurse typically would carry a caseload of clients who live in their own homes or clients who live in group homes. There they would also assess referred clients and provide the appropriate intervention, and this would include case management. Okay, that's a psychiatric nurse in the community. In the primary sector, in primary care, i.e. polyclinics or general practice as you would have in England, the psychiatric nurse would assess clients who are referred by their GPs and provide them with short-term intervention or right-side them to other agencies. So in all sectors, the psychiatric nurse is a person who lives and breathes mental health. And because mental health affects all other aspects of a person's life, physical aspect, social aspect, the psychiatric nurse has to work holistically, look at the patient's needs holistically, and for that she needs to work collaboratively with other agencies.
What are your thoughts on the negative perception or stigma against people with mental illness, particularly among the Asian community?
Do you know, Afzan, I've sat in buses and I've overheard people, talking about their high blood pressure, their cholesterol level, their diabetes, discussing freely. But you very rarely hear of people talking about their depression or the fact that they hear voices or how their OCD tendencies is affecting their lives. You very rarely hear people talking about their mental health challenges. And in some communities, if you tell people that you start hearing voices, that person will be deemed to be maybe a victim of disturbances from another realm, being possessed or even being spiritually weak. In Singapore, the word gila or siao in Hokkien, it has such a bad connotation that very many people do not want to be associated with it. There's also this general perception that oh my God, people with mental health issues are dangerous or violent. That's nothing can be further from the truth. In actual fact, a person who is experiencing a psychotic episode is actually himself more frightened of himself and of other people and those surroundings, of his surroundings. So these are all, the stigma, people's view of mental illness. There are stigmas and misperceptions, and these are hindrances to help-seeking behavior. Having said that, I have seen in Singapore many efforts being made to remove stigma. There are now, programs about mental health challenges on TV. There are, talk shows by advocates like your kind self, to allow people to talk about their mental health issues and bring it out to the open. And there are apps and websites pertaining to mental illness, and also NGOs, like I said earlier on, advocates who encourage talking about mental health out in the open. So we are on our way there to removing stigma and misperception.
Okay, so based on your experience, what do you think of the current mental health care state in Malaysia or the Asian region?
Asia region, wow, that is a big question. I think the care that you receive, Afzan, depends on where you go. Depends on where you go, because sometimes some people, if they hear voices or if they have strange thoughts, in some communities they might go to their religious leader. They might go to the mosque or the temple or church, so for that you will get spiritual guidance.
Yes.
Okay, so where you go, what kind of help you get depends on where you go. If you go to a hospital, you will inevitably be in recipient of the medical model, which is very linear. A doctor, being a doctor, will diagnose. You tell them your symptoms. The doctor will make a psychiatrist will make a diagnosis and then provide treatment. And then if you have an abatement of symptoms, that's it. As far as from his perspective, he's done his job. So it's quite linear, but you really have to look at a person holistically. I said earlier. So I don't think the medical model is adequate, to be honest with you, because it doesn't address the person's needs holistically. And also, some conditions, when I work in primary care, it's what we call subclinical, and you don't need medication. For example, grief is when somebody you love passes. Of course you will feel sad, of course you'll cry, of course you have sleepless nights. So maybe the support that is needed is not pills and tablets, but maybe just a few sessions of talking therapy, a listening ear with empathy. So the medical model is not ideal either. And I have seen in some other parts of Southeast Asia care that is really verging, mental health care that's really verging on the violation of human rights. Of a person's basic human rights, like tying up a person or restraining a person. So these things all have to be looked into. What kind of care you receive depends on where you go, really. And that there should really be to look at someone's needs holistically. That there should be a combination of medication, talking therapy, and good case management.
I agree with you there. As someone who has bipolar disorder myself, I am also seeking treatment. I am on medication, but at the same time, I also go to talk therapy. Because it's not all about the medication, but it involves a whole lot of aspects in my life in order for me to recover.
Exactly.
Yes.
And can I also give an example? I give an example for a person who is trying to understand this concept. Schizophrenia, for example, is one of the most debilitating mental illness, and it affects many aspects. For example, I give you a client of mine who was in his final year of university, where when he started to hear voices. When he started to hear voices, he got very, very frightened because he didn't understand, and as a result, his study was affected. So he didn't make his grades, and he had to leave university. When he left university, he stopped playing football with his friends, because his friends also did not contact him because when they were playing, when he was playing football with them, they noticed that he was talking to himself and he had some aggressive tendencies. So they stopped phoning him. So there you go. That's his education affected because he left uni. His friends, he lost social contact, and his sports, his hobby, which has kept him physically fit. So when he stayed at home, his parents, he kept away. He's got paranoid schizophrenia, you see. So he kept very much to himself in his bedroom, and because of that, his parents didn't understand what was going on, and the family life is affected. Also, when he has stopped going for Friday prayers. He usually went to Friday prayers with his dad, but since the onset of his illness, he has stopped going to Friday prayers. So, that's his spiritual needs being compromised. So, can you see, with just mental illness, schizophrenia, a person's social life, physical health, spiritual needs, family life is affected. That's why I say there has to be holistic and multifaceted approach. It's not just about medication.
Talking about getting professional help, we all know that private mental health care can be expensive, and that makes it almost impossible for people who cannot afford it to get the mental health care they need. So what is your view on that?
Yeah, in Singapore, a private psychiatrist or a private clinical psychologist will set you back $150 to $250 an hour. A 1 year inpatient treatment in a private hospital in Singapore will cost you about 200,000 Singapore dollars. So in Malaysia, you can buy a house with that.
True.
Our public sector is heavily subsidized, but you still need to have some cash upfront when you see a doctor from the public sector. The fact that you had to wait 3 months, Afzan, you told me that you had to wait 3 months to go and see a doctor in the polyclinic, in the clinic kesihatan. And you can't wait 3 months. You simply cannot. So to go and see a private psychiatrist who can charge you a premium. And then now they have this thing called they have insurance which actually cover mental illness. Just in the last year or 2 years or so, insurance companies are starting to cover mental illness, but not everybody have health insurance. So it is I think quite a shame, really. I think mental health treatment, like any physical health treatment, should be affordable and available for all. There is something that the powers that we need to look into. And also, there are in Singapore there are many NGOs. There are many NGOs that's being set up, and funded by the government and all that. Whole lot of them. But these NGOs, they have their own coverage area, they have their own criteria. Even when I was working as a mental health professional in Singapore, I was quite should I say perplexed at the numbers of NGOs that are available for this sector, for that sector and all. So I just wondered, how is the lay person, the ordinary person, going to know where to go? How are they going to navigate this plethora of services that's out there? So something needs to be done to bring all this thing together, or maybe have a system that only involves one port of call.
Backtracking on what you said just now about me having to wait 3 months, I would like the audience to know that was before I got diagnosed with bipolar disorder. That was me trying to making the first move to get the help I needed. And I was already having suicidal thoughts at that time. So can you imagine if I waited 3 months, actually waited 3 months to get the help I needed? That was when I decided I could not wait. But I'm lucky because I can afford private mental health care. So that
That's
is
right.
why, yes, I think something really needs to be done about the availability and affordability of mental health care in Malaysia and also the Asian region.
There is definitely an acute shortage of mental health professionals. In a study, an article published in the Taiwanese Journal of Psychiatry in 2019, the researchers did state that there's an acute shortage of mental health professionals in Singapore, and that so as we speak here, there's training implications. There needs to be more training of mental health professionals.
Harry, what is your hope for the mental health care system in Malaysia?
Oh, okay. Azan, it is really, I really like to see a kind of a complete overhaul to look into this matter, this, mental health aspect of health of the nation. There really needs to be a honest and a willingness to look and to make the necessary changes. It should start at school. Actually, mental health education should start at school, because it is the young people who will one day graduate and go out there and be working in an ever changing world. So emotional intelligence, I think should start at school. People really need to, in terms of developing it, you don't have to reinvent the wheel, Afzan. All you need to do is to go across the oceans, which is Australia, New Zealand, developed countries, in the UK. Rightly or wrongly, their system may not be the perfect solution, but they have come a long way, making very radical changes to their mental health care system. So maybe the authorities can have a look at that and have a complete overhaul. So we're talking about a campaign here. If you want to produce future mentally resilient, robust leaders, you really need to start now and to start to provide this kind of mental health care. So it has to be a multifaceted approach. Big companies also need to look after their employees' well-being. It's not enough just to provide EAP, employees assistance program, or pay their insurance when they have mental health issue. It's part of the human resource department to take care of the employees' mental health. Schools should also introduce mental health education, and I think there should be more training of mental health professionals and put them in all the clinic kesihatan to address this shortage, this long waiting list, and so forth. So it needs to be to look at it completely, a complete overhaul in all multifaceted approach.
All right, Harry, thank you so much for doing this interview with me. I was so glad you said yes when I invited you. Before we end this session, is there anything you would like to say to our audience, specifically to those who are involved in mental health care, and also those who are seeking help for their mental health issues?
Okay, for those who are seeking help, if your mental health issue really is affecting your activities of daily living, seek help, seek professional help. We live in the era of information technology. Do your research, but be mindful, because there are a lot of fake news out there. But information is literally at your fingertips. So look and seek help. If you worry about stigma of misperception, you should understand that you have only one life, and your mental health is very important, because it also affects your physical health and all other social aspects of your life. So for those who are having mental health issues, I would say seek help. And for those who are in the mental health industry, you really need to look at the person's needs holistically in whatever you do. Look at a good example would be to look at the recovery model of mental health. It's all out there. The information is out there. That is quite holistic, and it's very, very empowering. So that's the message I have for both people seeking mental health treatment and people providing care. Thank you.
Harry also wrote a book, You Can Be Your Best. I got my copy right here. Harry, would you mind talking a little bit about your book?
Oh my God! Oh, okay. This book was started. It started a long time ago, because I wanted to write something that is again holistic. In all my experience when I interact with my clients, because I work in the community, I've worked in the hospital, I've worked in primary care, I find myself keep saying the same things over and over and over again. So one day I was thinking, why don't I put everything in one book that is easy to read in layman's language, and also without the psychological jargon that you find a lot in self-help books. So You Can Be Your Best is distilled information on how to preserve your mental health, which also includes goal setting, because I'm a certified life coach. So it's small. It's also a workbook. It's a book for people with mental health issues, and it's also a book for mental health professionals. This book you can use as a tool to help you in your work with your clients. So it is stocked in the National Library of Singapore, and it's also on sale in soft copy in my website www.recovernow.com.sg.
Thank you, Harry, and I hope we can do this again and talk about another topic.
Definitely.
In future interviews. Thank you so much, right, everyone.
The honor is all mine.
Thank you, everyone, for watching. So I'll see you all in my next episode. Bye.
Thank you. Bye-bye.
Harry is a psychiatric nurse, life coach, and oh my God, I forgot my script.